Dr. Somnath Chattopadhyay. I head the Department of Liver, Pancreatic and Biliary Surgery and Liver Transplantation at Kokilaben Dhirubhai Ambani Hospital in Mumbai. I'm going to talk about viral hepatitis, which is a very common problem that we face in India and especially in Western India. Viral hepatitis can be divided into mainly 5 categories. It's based on the alphabets: type A, viral hepatitis type A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. They are different in some manners. I'm going to talk about them in a little detail. Hepatitis A and hepatitis E are basically transmitted by unsafe or dirty water or food habits. So these are known as infectious. Mainly they are more prevalent during the monsoon or the rainy season, where there is contamination or spoiling of the water, drinking water sources. Hepatitis B, hepatitis C, and hepatitis D are mainly transmitted through unsafe. These are mainly sexually transmitted diseases, which are transmitted by means of unsafe sex or sharing of IV needles and things like that. So a little bit more about hepatitis A and hepatitis B, especially during the monsoon season. We see a lot of these patients. These involve children and adults alike, and the main symptoms would be presence of fever, weakness and pain in abdomen, and some patients will start developing jaundice, and once the tests are done, we see some abnormalities or in the liver function test, which is a very basic blood test. The treatment, there is no specific treatment that is required for hepatitis A and hepatitis E. Usually a general supportive care, good diet, and a treatment for fever and weakness in general is going to be enough. The liver has a property to repair itself, and most of the cases, about 95% of the cases, are self-limiting. That means they will get better on its own with some symptomatic care. A very small percentage of these patients of hepatitis A and E will progress to what we know as liver injury or liver failure. So if the jaundice is not getting better, or there are other derangements in the blood test, then the patients are advised to seek more specialized care. They should go and talk to their physicians, and then maybe in a very small percentage of patients also need to be admitted for it. So this is about hepatitis A and hepatitis E. The prevention is, as I said, the transmission is through bad or contaminated water, or having raw, salads which are washed in polluted water or contaminated water. So the precautions are the same, are just the opposite of that. That means we should make sure that the water that we drink, especially during monsoon season, is boiled or filtered. We have to make sure that we don't have salads in place where the hygiene is not good. And at home, we should wash the vegetables very thoroughly before making a salad. Cooked food, the viruses that get destroyed in cooked food. So that is one way of taking care that we don't get this infection. Hepatitis A vaccination is available, which can be given to children, which will help prevent very severe disease. This is about hepatitis A and hepatitis B. Next, we'll talk about hepatitis B, hepatitis C, and hepatitis D. Now, these are diseases which spread through bodily fluids. So these are usually sexually transmitted diseases, or by sharing of needles, or most blood banks or blood transfusions are now checked for these viruses. So it's very rare to get a transmission through blood transfusion. These usually, most of the cases of hepatitis B and C, which are the predominant forms, will not have any symptoms, and the patient may or may not develop a self-limiting period of jaundice and fever, which usually gets better on its own. Most patients, 3 out of 4 patients of hepatitis B or C, are not even aware that they have these problems. These can be detected by doing blood tests, where we check for the presence of viral antigens and antibodies. The symptoms, usually most of the cases will not have any symptoms. Some cases will have symptoms like fever and jaundice. The problem with these two diseases, most of the about 20% of hepatitis B patients and about 80% of hepatitis C patients will go on to develop liver cirrhosis. So that's why it's if someone has received is indulging in unsafe sexual practices or IV drug abuse, or has had a surgery about 2 decades or 3 decades back, then they should get their blood checked. And if there is hepatitis B or C, then they should take proper treatment. Prevention for hepatitis B, now we have excellent vaccination programs, which is a part of the universal vaccination schedule, which protects you from hepatitis B. Hepatitis C, there is prevention is in the form of lifestyle changes, like avoid unsafe sexual practices, avoid sharing of needles, avoid drug abuse. This will take care of hepatitis C. And there is now excellent antiviral treatment for hepatitis C, which can cure it to up to 99 to 100% surety. In this way, I think there are some preventive measures and some medicines or vaccinations which can help take care of this hepatitis. So this is all about the kinds of hepatitis. I hope you have had some information about the various types of hepatitis, viral hepatitis that we have. Thank you so much.